Hi, I'm Dr. Janet Pope here at Room Now at ACR 2020, the virtual convergence meeting. I'd like to talk to you about something that will change my practice. So I'd like to ask you, do you actually routinely take a vaccination status and have your immune suppressed patients with RA, lupus, other diseases get vaccinated against pneumococcal pneumonia? This is a common pneumonia. And there were two abstracts that are important in a live session, abstracts 456 and 457. In abstract 456, what they did was they looked at their patients who got pneumococcal vaccination, albeit it might be a different one than what you use in your country. But in general, they vaccinated the patients who were higher morbidity, more comorbidities, more corticosteroid use, things like that. When they looked and matched the vaccinated patients with the unvaccinated patients, they wanted to look at would pneumococcal pneumonia decrease further pneumonias. And they had 595 vaccinated patients with rheumatic diseases, and the non-vaccinated references were 103 patients who had infections before vaccination, 48 of the 595 that were vaccinated, and 103 of 2379 who were not vaccinated that had had infections prior. Then they looked at the event rate after vaccination for up to 10 years, and they matched on risk factors. And the bottom line is, even though the patients who were vaccinated were higher risk for infection, they had less infection with almost a 50% reduction of infection. They had time to first pneumonia being less. And again, when you match for the variables, this still was statistically significant and clinically relevant. So for me, that'll change my practice because I really have to go back to my clinic next week and start asking about vaccination status and just getting on with vaccination. The next study was showing us how we could implement this. So abstract 457 was a presentation looking at whether or not they could increase pneumococcal vaccination rates in a regular clinical setting. And they did a series of quality improvement implementations. And like anything, if you talk about it, it's more apt to happen with the patient. But if you facilitate it, it's even more likely. So a few things that I do in my practice and will continue to do better is systematically ask annually, ask my high risk, but all my patients with rheumatic diseases over a certain age, such as 40, and look at putting signs up in my clinic room when I'm seeing them non-virtually, also writing a prescription, or even better, having the pneumococcal vaccination ready and at hand. If you need to know more about this, CDC has guidelines for pneumococcal vaccination for our immune suppressed patients. Thank you. I hope you're enjoying ACR 2020 Convergence, and follow us at Room Now. And my Twitter is at Janet Burdope. Thanks.